In the IVF lab, either we freeze the ovocytes, that's the eggs for the patient, or the embryos for the couple. There are two different indications for the egg freezing. When we do egg freezing, that is where the couple or where the female has going to be in advanced age, and we want to preserve her fertility so that we can utilize those eggs later on. Or if unfortunately the patient is going through some kind of a cancer treatment, so we need to preserve her eggs beforehand so we can freeze her or save her fertility for the later use. That's the one aspect. The other aspect is the embryo freezing. In normal case of an IVF, where the medications are given, normally the 10 to 12 ovocytes are produced in each cycle. These ovocytes are fertilized, and on average for each couple we have about 8 to 10 embryos. That means where the genetic material of both husband and wife have combined, and now a new embryo is generated and it is developing. Now these embryos, by law here in UAE, we cannot transfer for more than 2 embryos under 35 years of age, or maximum 3 embryos in advanced age. So if there are surplus embryos, we like to freeze them. The reason is that when we have embryos frozen, the patient need not to go through all the medications and the procedure of egg retrieval, and the patient can only utilize those frozen eggs without going through all those previous treatments and the medications and the procedures. That's the one aspect. Number two aspect is of embryo freezing is that where we like to test the genetic competency of the embryo. That is, the patient female, either the female or the husband is suffering from some genetic disorder, or the female herself is of advanced age, and there are chances that the baby born to that couple because of her advanced age will be of abnormal genetic composition. So we would like to test those embryos. So in these advanced age patients, we don't have enough ovocytes, eggs to recover. In these patients, we accumulate the ovocytes in 2-3 cycles. We do the 2-3 cycles and we recover the eggs, and we freeze and we create the embryos, and then we freeze the embryos, so that when we are going to test the genetically embryos we are going to test, at that time we have enough embryos to test. So that, in other words, we have enough embryos to test, there will be more chances to have the normal embryos, and that will eventually increase for the patient to get pregnant, with chances to get pregnant. The egg freezing and the embryo freezing procedure is the same. Like any other cell, the embryos or the cells have enough water inside. If we freeze them straight away, this water will turn into crystals and will kill the embryos. So what we do is that we put them in a special media which sucks the water out, and it is replaced by those protecting material inside, and then we freeze them quickly, putting them into liquid nitrogen. The temperature is minus 196, and by law we can keep the embryos and the ovocytes frozen here in UAE up to maximum 5 years. So we have then chances to use those embryos during these 5 years.